guys, welcome to my channel. It's your girl Helen once again. So guys, it's been a while. I made a nursing video. So most of the video I'm making recently are like holiday vlogs and so on. So I decided to make a list. I made a list of some points about today's topic. So it's just all about what you can expect during your Einsatz, during your first day at the practice. So the thing is that a lot of people do not know what to expect. Someone actually asked me this question, and I was glad she did. She came to my inbox and asked me to give her some tips. So today I'm going to be talking about sharing those tips with you. I already shared with her some of them, but I hope she's here and she sees this video again. Although she must have started her Einsatz by now. So guys, I made some points because sometimes I talk and I forget some of the points that are in my head, so I prefer to write them down so as not to forget them. So one of the first things you have to expect on your first day, it doesn't matter if you're going for your praxis, first Einsatz, or you're going to you're doing a practicum, or your whatever it is, or you're starting, you're in Germany, you moved to Germany newly, and you just want to integrate into the system, or you started working at a hospital. So these are some of the things you should expect, especially if you're a foreigner. Of course you should be a foreigner to do that, especially if you don't know how to speak German, if your German is really, really bad. So guys, don't worry. Even if your German is bad, don't worry, you're going to survive it, okay? So guys, one of the points I made as some of the things you should expect during your first day at the praxis is that you're going to be confused during the Übergabe. That is the handover. The Übergabe is called the handover. So even now, I'm still confused. I still get confused sometimes. Not really, because some of the things I don't understand. Some of them are not in my outside my. I've not gotten to that stage where I should know them now. So, and I don't worry about them. I just pick the most important ones. So guys, if you don't worry yourself. If you don't understand anything, don't worry. But just know that you're not going to expect any. You're not going to understand anything. Or you might understand like 20% of what's being said. So, but don't worry. You're going to get there as time goes on, you progress. So the second one is that you're going to meet colleagues who are racist. That is number one. They're racist, but they're not going to show you that they're racist. Yeah. So I've been there, done that. So nobody's going to tell you I'm racist, or nobody's going to show something, but nobody's going to say something about your race or whatever, but they're going to show it. Like some of their attitudes are going to tell you that, yeah, this is racist, but just ignore the person, okay? So the third point is that you have to do a lot of walking. I remember when I did my practicum, guys. It was tiring. Like I walked and walked and walked. I didn't expect to walk that much. Like I walked. You have to do a lot of walking. Imagine walking for 8 hours. When you're fit for 8 hours and you're gonna sit for just 20 minutes. 20 minutes break. That's the only time you have to sit down. So apart from that, every other time during the whole 8 hours, you're going to be walking. So expect that. Okay? So, and that leads me to the fourth point. So get yourself some comfortable walking shoes. If you want to be, if you want to survive, get yourself some comfortable walking shoes, and then you're good to go. Okay? So, and let's see, the next point is that after you're going to feel tired after the whole day. Of course, after working for the whole day, you're going to expect to be tired. Okay, let me tell you what happened the first time I did my own. The first time I did my practicum, I was really tired. I came back, my feet were really tired, like not just tired, paining me, like they ached like crazy. So I had to get some crystals. I bought it from TM. I got it, so I put it in the water. It's just for the fuß bath. It's called fuß bath, but it's called just like one of these things you put in the bath when taking a bath. So that's one of the things I use just for my leg, just to suit my feet. So I put my feet in the water for good 15 minutes or 20 minutes. Yeah, and it relaxes me, and next day I feel good and I'm good to go. So the next so expect that as well. You're gonna be tired, so and don't worry, it's just a matter of time. You're gonna get used to it at some point. You're gonna be tired to the extent that you would want to quit, which is the next point. You might want to quit, yeah, because you think, oh, okay, I cannot do this anymore, I am too tired, I have done this. You're gonna come back home asking yourself questions. Why am I doing this? Why am I doing this kind of job that requires that I work, I do this, I do that? But one thing is to remind yourself why you are doing that job in the first place, why you agreed to do it in the first place. And one of the things I used to console myself was that I consoled myself with the fact that a lot of people are doing that same job and they've not died. They still work. Like, even though I still, like, it was like, I was wondering what it was like for them. So if I remember the fact that a lot of people have been doing it, they come to work every day for so many years and they're still alive, they still survive, why can't I do it? So if you think about all this, you're gonna, and to ask yourself the reason why you came into the job in the first place, or why you chose this career in the first place. That way you're good to go. Okay, get enough strength, you get strengthened and get motivated and get up for the next day. Okay guys, so the next point is that the next thing you should expect is that everyone, you're a newbie, you're the new person, so everyone will try to send you on errand. Yeah, you are the youngest, you are the new person, you know nothing. Like everybody, like, that edge people have over you when you're new in a place, like you don't know anything, like people want to send you and you're going to be confused as well. So, but also prepare to meet the bossy ones. So as long as they're sending you on errands, there are people, some of them are not the boss, but they act like the boss. So you should expect to meet some people. They are not the boss, but they act like the boss. So, and also, not just that they're not the boss, they're just normal colleagues. Even though the only difference is that they are qualified and you are not qualified, but they're not the boss. But you're just gonna have to expect that and then not take it personal. Okay, that's what happened. It's normal. Expect it and do not take it personal. It is completely normal. Okay, and accept everything with happiness, with smile. Just do everything smiling. Yeah. Yeah, even if you're sad, if you're sad, go to the bathroom, take a bathroom break. Go to the bathroom break. Okay, that is also one of the tips. I'm gonna make another video where I'm gonna give some of the tips you need to do, just the tips you need to survive your praxis. So, and one of them is just to smile. Go to the bathroom, smile. Yeah, and just smile before the person. And if you go to the bathroom, you can cry. Feel free to cry when you get to the bathroom. Yeah, it's normal, okay? And come back, clean your wipe your tears and continue your job and keep smiling till the end of the day. So guys, the next one is that everyone usually seems to be in a hurry. So yeah, this is where it gets funnier. Everyone seems to be in a hurry in the sense that a lot of people they have lots of patience, and there is an allotted time in which these colleagues are supposed to finish their jobs. And a lot of things goes on, especially during the morning shift, and everyone is trying to meet up their targets. Everyone is trying to finish what they have to do with the patient. So you're going to have a problem if you don't speak German, if your German is not fluent. Yeah, do not worry, that is also one of the things that every foreigner has passed through. Every foreigner who is working as a nurse, that is what they have passed through in Germany before they became perfect, before they could be able to speak fluently. So because everyone is in a hurry, some people might try to avoid you, some people might not try to talk to you. So just imagine trying to talk to someone who is in a hurry, someone who is expecting you, standing and expecting you, like, hey, say something. Yeah, was brauchen Sie? Yeah, oder was brauchst du? So imagine when someone asking you, like, you don't know what to say, like your Dutch is not fluent, and someone is expecting you to say something in a hurry, like say something like say something like in a hurry, like what the patient said or the son said, I need this, I need that. So it is completely normal to feel that way, and at some point you're gonna feel there's what they call overfordert. I don't know, I've forgotten the word in English, but you're gonna feel overfilled, like overwhelmed, like this is too much or something. You're gonna feel confused because no one seems to be paying you attention. But not to worry, you're gonna get there, okay? It's gonna pass. It's just a moment, okay? As time goes on, you'll get used to it. So, and as time goes on, your German would also improve. Yeah. So do not be afraid. And because and another point is that because you are pissed off, because because those things are gonna piss you off, like you're gonna feel like you're failing or you cannot do anything. So those things are they're gonna frustrate you, and you're gonna go home. And some of them are gonna frustrate you, like you're gonna see physically, like they don't have time for you. They don't have time for you. So you're gonna feel frustrated, and you're gonna feel like angry. And when you get home, you feel tired. You feel like quitting. You feel like giving up. You feel like not going back to work the next day. It is completely normal. So do not say, oh, I'm not going to go to work the next day because Mr. A did this, because this colleague did this, or that colleague did that. No, it is normal, okay? I am telling you from experience. Everything I'm sharing are from my experience, what I've expected during my practicum, and now that I'm doing my Ausbildung. And not just that, from also some of my colleagues, from experiences from some of my colleagues. We were actually talking the other day about something about everyone's experience during their first Einsatz or during their first time at the hospital, and it was a really, really laughable experience. Everyone's experience was just really funny. So don't worry, you're gonna get home tired, but you're gonna make it, okay? You're gonna feel good the next day when you get back to work. So, and the next thing I want to say is that you may the next thing I want to say is that you need some confidence. So and that was the last point was for me to this. So you're gonna need a lot of confidence. So because people are gonna be expecting you. You're gonna meet doctors. You meet doctors. You meet nurses. You meet other workers from different areas, like different departments, and they come and go. They expect you to say something. They ask you questions. Some people who don't know you or who think you're already in the department for a long time, or people who think, okay, she's a colleague. They don't know the difference. Some of them don't really know the difference. And patient, they don't know the difference. Also, the patients know. So they're gonna ask you some questions, expect you to do anything, expect you to answer some questions. If you don't know them, just say, I don't know them. I'm new here. I don't know anything. Today is my first day, or this is my first week. I do not know anything. You can refer the person to the other person. So you know how best you express yourself, even though your German is bad or it's not that good, but you know how best you can express yourself so the person will understand what you're telling him or her. So, and that is the next point is that you should also expect that patients are going to call you, nurse, like, ask you some questions. Hey nurse, hey Sylvester, hey blah blah blah, and they're going to expect you to answer some questions too, like I pointed out earlier. So, and they're going to expect you to do some certain things that you're not supposed to do yet. So, and just tell them you're not supposed to do them, you're not allowed to do them. And also know that as a new person, there are some things you're not expected to do. You're not supposed to do them. Not expected to do. You're not supposed to do them. So just refer whoever it is that expects you to do that. Some patients might tell you, do this now, nobody's gonna see you. No, I can do that myself. Ich kann das doch machen. Ich kann das doch alleine machen. Na? Ich kann das doch selbst abmachen. Yeah, tell the person, no, don't do it. I'm going to call someone who knows better. I cannot. Someone say, oh yeah, I'm going to teach you how to do it. No, it has happened to me so many times. So all I do, I call someone who is my experience that I am, and the person helps me to do that work with the patient. I mean, to help the patient do whatever it takes that needs to be done. So do not let the patients coerce you or push you into doing things you don't want to do, or things you cannot do, things you're not sure about yourself, or things you're not sure you can do. It could be that you've worked in a hospital in another country, but the problem is that you do not understand German, or you're still trying to integrate into the system, into this very hospital, or into the German hospital, or that you are still you've never worked at the hospital, you've never had any experience before at all. So whatever it is you're not sure of, do not let any patient coax you into doing that at all. And if they call you Schwester, do not always try. They're going to call you Schwester, la 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 la. So do not always explain to them. Or sometimes you can explain to them, tell them, I'm a practicant, I am new here, I am a student, I cannot do some certain things. I'm not allowed to do some certain things. It's as simple as that. And a lot of them are going to respect your decision. Okay? So another thing you should expect is that sometimes because you're new, because you're overwhelmed, you're going to come back thinking about some things you didn't do. You're going to think, okay, did I forget to do this? Did I forget to do that? Did I forget to give this information, pass this information on to my colleague or something? What did I forget to do? So these are the things you're going to, the questions you're going to ask yourself even when you're on the bus. You remember that you ask yourself some questions. Did I make any mistakes? Did I leave anything behind? Is there something I should have done that I didn't do? So guys, this is all I have for now. This is all the tips I have for now. Okay, and on the point of the patient expecting you to do anything, also some of the colleagues are also going to expect you to do those things. So tell them that you cannot do it, or you refer them to someone better. So guys, this is where I'm going to end, and this is all the tips I have for now. I believe that some more tips I got, some more styles are gonna pop up into my head. Some things I might expect. So and I'm going to write them down. And I'm going to write them down. I'm going to make another video. So do not be surprised if you see another video having the same heading. Okay, saying what you expect, which is what you expect during your practice. So guys, it's been nice doing this video, and if you're new to my channel, make sure you subscribe, and if you make sure you like, subscribe, and leave a comment. And if you're an old subscriber, please make sure you like, comment, and share to your friends. And I hope to share more tips about my practice, about my experience in the health department as a nursing student in Germany. And also there are so many tips I have to share with you guys, but we're going to do that step by step, or gradually. Okay, so so guys, see you guys in my next video. Bye.